Okay, this segment is going to be on swine flu, the Asian flu, or for that matter, any kind of flu. In 1928, there was a worldwide flu epidemic. It was killing 98% of those who developed pneumonia from the flu, called influenza pneumonia. For the first time in history, doctors gave intravenous hydrogen peroxide to patients who were on the death list, who were slated to die from influenza pneumonia. Lo and behold, 48% of those slated to die lived. Now, this was the first realization that viruses can easily be killed by hydrogen peroxide taken intravenously. Now, as good as this news was in 1928, which was before antibiotics and before antiviral drugs, the pharmaceutical industry today doesn't want you to know about hydrogen peroxide. They don't want you to know how cheap it is. They want business as usual. But there were some doctors who cared. One doctor's name was Charles Farr from, I believe, Oklahoma City, Oklahoma. He began using and teaching hydrogen peroxide to other physicians. He started something called the International Bioxidative Medical Association, or IBOM. But with Dr. Farr's death, IBOM soon became defunct also. Worse yet, the doctors who were doing peroxide treatments have been belittled and discredited by the pharmaceutical industry and somewhat by local branches of the medical associations. Dr. Steenblock, who was trained by Dr. Farr, still offers an annual course to doctors on how to do peroxide treatment. Here in Arizona, we have something called the Arizona Homeopathic and Integrative Medical Licensing Board. The Constitution specifically permits specially trained licensed holders to practice hydrogen peroxide therapy. The pharmaceutical industry be damned. There is and there always has been a treatment for the flu or for any virus. And I say, don't let orthodox medicine and those who believe it scare you. If you think you've got the flu, find a doctor that does peroxide and get it treated. At my office, we even have a hospital bed in a private room for treating people with the flu. You can come in, lay down, and take the treatment. But you gotta make it to the office. You gotta drag yourself here.